You're watching Arkansas Style on KARK.
Today, it is my privilege to introduce you to somebody who might quite literally change your life and your perspective on life. I am joined by Dr. Melisa Boersma. Melissa, great to see you.
Good morning. How are you? Good to see you.
We are well and looking forward to our conversation. Of course, you're a beautiful wife and mother, but let's start with really what your day job is, what pays the bills, and kind of the jumping off point for that.
Yeah, I am a clinical associate professor in the Department of Radiation Oncology at the University of Kansas Cancer Center. So in my day job, I take care of primarily cancer patients, general, all kinds of things. And that is a huge pleasure and privilege to be able to do that. So that's what I do most days.
Yeah, so I mean, serious subject for sure, tough stuff. You're dealing with life and death situations every day, all day. But that's kind of where you've found yourself becoming almost a life coach, a surrogate life coach in your practice. How did that evolve?
Well, I realized that I actually am already coaching people. Most of the treatments that we do transpire over a period of multiple weeks. Monday through Friday, 5 days a week. It can be very physically, mentally, emotionally, spiritually burdensome for patients. It's often something that they haven't really got a lot of experience with. And so there's a lot of fear and unknown. So a lot of what I end up doing, aside from the technical aspect of treating their cancer and making appropriate standard of care recommendations, is helping them manage their minds. Helping them focus on the things that are going to make it possible for them to get from day one to the end of the treatment and have the best possible outcomes. And so I thought, if I'm already doing both, why not just do both? I have a lot of my colleagues who also have pretty stressful jobs, and to be able to continue to do that and do it well, it's a lot of a burden on the physician providers as well. So
yeah, this is what makes you unique and different. I mean, a lot of us look to our doctors for our care, of course, and they seem busy and they're, really just focused on the task at hand. But you take it that step further. You do a more humanistic approach. Can you kind of give me an example of how that came about? Maybe a general conversation that you've had with a patient and how you kind of guided them through that?
Yeah, I frequently have people who come in who are not very familiar with radiation. They don't know what's going on. They have a lot of fear. They have been searching the internet and received a lot of information that may or may not be very accurate. And so helping them kind of make a plan for how they want to experience the journey. Everybody's different. Everybody has different background, upbringing, cultural experiences, faith experience. And so even though someone may have the same diagnosis as the person sitting next to them in the waiting room, their experience of what the entire process is like can be vastly different. So I think just being able to hold space and lean in, have those difficult conversations and meet people where they are is extremely critical to being able to be successful for the patient and for their family in reaching their goals.
So you, a lot of this came naturally to you. Maybe that's just, your human side of things. But you also took it a step further. You went and got professionally trained as a life coach. Tell us a little bit about what a life coach does as a difference to a counselor or a therapist.
Sure. Now, life coaching is not a regulated industry the way that being a physician, you need to have licensure and other types of specialties. So pretty much anybody could become a coach. But for me, I did get training. I got great training, and that just helped me kind of level up my ability to provide some of those skills. Typically, counseling and therapy, I'm a huge fan of that. I think it can be very valuable for people who are struggling, trying to reconcile or come to terms with their past experiences. Where a life coach is different is rather than looking to the past and past experience, to help guide future decisions, a life coach really helps people focus more forward. In other words, if you want a different result in your life, if you want something new, a different experience, if you don't want to be sitting around next year saying, oh, this always happens to me, here I am again, you need to be able to put yourself in the position of that future identity and create new thoughts, create new feelings that would guide and inform the decisions that you make so you can actually experience that.
As you take on this new role, you know, you're changing your career path just a little bit and adding to it. What would you say to somebody who wanted to contact you to hire you as a life coach?
Oh yeah, they can visit my website, melisaboersmacoaching.com, and reach out. I'll contact them back and see if there is a match there. If not, I have a plethora of great life coach acquaintances and colleagues that would probably be available as well. So, yeah.
All right. So another, which is kind of an interesting outlet that you've taken to your day and relieving some of the stress, is that you've started drawing cartoons. Tell me a little bit about that backstory.
Well, I spent a lot of my career working kind of in the basement of hospitals and different places. There's not a lot of people around to entertain me. Got to entertain myself. So I had this little whiteboard outside my office, a dry erase marker board, and usually would just write random comments on there, questions for whoever was passing by. Somewhere along the line, one of my patients gave me a stack of dad jokes. I love jokes. The cornier, the better. Love to laugh, love to kind of goof around and be my authentic self with my patients and my staff. And so there's actually quite a bit of data that having a happy mindset is likely to improve your creativity and problem solving. And I definitely need that in my job. So I have this little magnet that came with a board. I took an old picture of my face and stuck it on there. And I've just been moving her around and started illustrating those jokes. I was doing it primarily just for my friends and my family. But then I found out randomly that people in other parts of the cancer center were actually walking past my office and taking snapshots of those silly cartoons and sending them to all their friends. So even though I was never on social media, I had a following and I didn't even know. So it's kind of funny.
Well, I think your following is going to continue. Melisa, I mean, a woman who wears many hats, but you touch our hearts in such a significant way. Great to see you, honey.
Thank you so much. Have a great day. Thank you, everyone, for having me.
Thank you. Dr. Melisa Boersma, I mean, talk about a full life and, of course, a life coach now. If you're looking for some extra help, give her a call. Still ahead, we'll hear from Legacy Wine and Spirits about their Bourbon Bash featuring tastings, prizes, and more. You won't want to miss it. Stick around. You're watching Arkansas Style.